Hello there, and a warm welcome to another EMIC Fireside Chat webinar. We're all here today to have a relaxed discussion about significant developments, challenges, and some promising solutions in the ever-evolving world of digital mental health. Our ultimate mission in EMIC, as always, is to make a meaningful impact and significantly improve mental health outcomes for our communities. We aim to achieve this by openly sharing our insights, exchanging knowledge, and cultivating global best practices that can truly make a difference. I'm Gregor Henderson, and I'm thrilled to be your host for today's webinar, Fireside Chat. I'm a board member of EMIC, and I have had experience of working in the mental health field for a long time. Prior to 2 years ago, I was the Director of Mental Health at Public Health England. Since leaving Public Health England, I have been working with a number of different organizations and agencies. And some of those agencies are working in the digital mental health field. And I'm very passionate about ensuring that digital mental health makes a difference and is more about meeting needs of people, communities, and organizations than it is about the technological advances that are rapidly changing even as we speak. So today is all about exploring the progress we've made in digital mental health around the world since the EMIC Congress, which was held in Auckland in November 2022. I had the good fortune to be there and met all of our panelists who are going to be joining us later. During our chat today, we'll be looking at some of the major topics that are bound to spark an interest and get us into a very fascinating discussion. We're going to take a closer look at the ever-changing landscape on global digital mental health ecosystems and the hurdles and opportunities that we're facing. We'll also dive into some of the advances being made to seamlessly integrate digital technologies into national care systems. And we'll see what's inspiring global initiatives and leaders to combat mental health stigma and discrimination around the world. And we'll also be looking at the huge and incredible collaborations that are taking place, bringing together experts, those with lived experience, and others from their respective fields to promote best practice and make progress towards achieving the UN sustainability goals. We are incredibly fortunate to have a fantastic lineup of expert panelists joining us today. These folks are true rock stars in their respective fields with a wealth of knowledge and experience when it comes to driving progress both at the national and at global levels. Before I bring out our first speaker to the virtual fireside, I have a few housekeeping items to cover off first. First of all, we're very interested to know where everyone's joining us from and what brings you here today. If you want to share, you can add your country, organization, areas of interest next to your name by clicking on the 3 dots on your name tag and selecting edit. It's also a great way for you to connect with others on the call who share your interests. We love questions, and if you have a question, feel free to post it at any stage during the webinar in the chat box. And once we reach the Q&A section about halfway through, I'll do my best to pose as many of your questions as I possibly can. Today's webinar is being recorded, and we'll be sharing the recording in the EMIC Knowledge Bank soon. And if you haven't checked out the EMIC Knowledge Bank, please make sure you do. So just a reminder, you need to be an EMIC member to access all the fantastic content in there. And it really is an absolute treasure trove of beauties. So it's my great pleasure to get us going, and I'd like to introduce our first speaker for today. It's my great pleasure to introduce to you Anna Elders. Anna is the clinical lead at Just a Thought, New Zealand's digital eCBT service, a mental health nurse practitioner and CBT therapist, working in primary care, and is the co-chair of the Digital Wellbeing Industry Group, a special interest group of the Digital Health Association. Anna is currently focused on building collaboration with New Zealand's digital mental health, addiction and wellbeing community, and was the recipient of the 2022 National E-Mental Health Implementation Leadership Award for New Zealand. Anna, welcome, and we look forward to hearing your 5 minutes.
Kia ora, and morena everyone, and for some of you it won't be the morning time, it'll be different times in the night, so thank you for joining. I'm going to share what I hope will be a relatively quick presentation, and I have got slides, so apologies for anyone that doesn't like them. This is just to really sort of help set the scene in a way for our talk today, and just to share some of what's happening in New Zealand and Aotearoa, so that we can introduce where we're going and hopefully have some inspiration for everyone in other parts of the world. I want to really ground us just by getting us to think for a second about what we're actually trying to do in this space. Everyone will be here because in one way or another they're trying to work to improve the level of well-being that's present at the moment within our societies. And we have to be aware and just take stock for a second that this is one heck of a goal. Now, the next slide is perhaps slightly doomsday, but I'm going to just have a quick run over of what we're actually up against here, just to have a little bit of that context. So we've got to be really mindful that firstly, we're an incredibly complex species as humans, and you only have to interact with each other to really understand that. We're living with the inequitable impacts of a long history of multiple unresolved traumas around the world. We're trying to improve outcomes of our societies amid competing political agendas, and we're also doing that with really under-resourced systems. And we're struggling in amongst all these challenges on what we know is a really rapidly deteriorating planet with a whole range of changes that are occurring that are further affecting the well-being of our populations. So we are really at a time of great challenge trying to do amazing things. So we know that we've got a whole bunch of incredible people in this space, but we've got to really reconcile that we've got an infinite number of problems at this time. And the great challenge with that is also that in amongst our thought leaders in the world and those that are passionate and inspirational around transformation and leading out the changes and the outcomes that we need, that we've also got an equally infinite number of possible solutions. And that in itself can become as much of a problem as the number of problems we're facing. So we need to get really smart about how we're going to start to corral ourselves and take these infinite number of possible solutions and turn them into the right solutions at the right time, catered in the right way for the right outcomes that we want to achieve. And I think that this is the great challenge that we are running at currently. Just to give you some background about what's happening in New Zealand at the moment in Aotearoa, we've had some significant changes. As many of you may know, some of you will be Kiwis joining this seminar. New Zealand have a very important, some very important work to do in terms of our Indigenous population. Māori experience some of the greatest challenges with their health and well-being, and equity is one of the biggest concerns in how people are receiving outcomes care, and how Māori whānau communities are currently, experiencing poorer levels of well-being. Last year, the Te Aka Whai Ora was brought into being. This is a new Māori health authority that's part of our reformed health system that has been set up specifically to really look at co-governance and partnership for Māori when it comes to health and well-being. Te Aka Whai Ora has been established with a drive to focus on hauora Māori in the system, so that's Māori well-being and the restoration of well-being for Māori within New Zealand, working jointly with the Ministry of Health and Te Whatu Ora, which is one of our new parts of our system, to really agree together on those strategies, plans and priorities. So this is a very exciting time for, we are a multicultural country, but we have a strong bicultural focus in New Zealand with our Indigenous population. And I just want to point out here that Te Aka Whai Ora, in and amongst their priorities, have highlighted at number 4 that digital services will mean that many more people will get care they need into their homes and communities. So digital has been identified by Te Aka Whai Ora as being one of the enablers for the changes in equity outcomes that they wish to see for Māori. Now, around a similar time last year, the digital mental health and wellbeing community began getting together, driven through our organisation DHA and our wellbeing industry group, to pull together a number of experts on the ground outside of government who have been very concerned about some of the challenges in optimising digital and some of the opportunities that we're missing out on achieving. So there have been many groups meeting and having these passionate discussions about potential opportunities. So what we attempted to do was really corral those groups, to bring them together in a central focus and to look at what would be needed over the next 5 years to bring about optimisation to really move the dial in digital in our mental health and addiction and wellbeing sector. And so it was a beautiful tour, hui, a meeting in which we were able to very quickly focus down on some key themes and points and produce some action points. And we put out a paper around this in June 2022, and it's an action piece that we see as a stepping stone. So those actions were around centering what we're doing around communities, and the Treaty of Waitangi that was signed in New Zealand that is around that central partnership with Māori, that was signed historically a long time and that we're still really working very hard to attempt to try to honour, to support the strategic direction, leadership and governance, to be able to understand our ecosystem in New Zealand, where it is at the moment, and work out where are the gaps and how we grow it, and enhance that implementation of solutions and integration in traditional services, and of course with the tools themselves, and to really look at how we can optimise research and data to learn what we need to drive further innovation. So what we're seeing recently with changes, there has been distrust with, those stakeholders that are funding and some of those developers and solution makers that are coming up that require support and require funding to get their solutions in and working. And so we're really trying to broker those relationships and improve them, because if there's not trust, if there's not transparency, then there are huge challenges in what we're attempting to do and making these changes. So we're seeing it coming together, and we've reached out and we're developing beautiful relationships with our central government agencies, Te Whatu Ora, the Ministry of Health and Te Aka Whaiora, and we're starting to look at how we combine our resources as researchers, as industry members and developers in the digital solution sector, as people with lived experience, as those services that are championing the implementation of digital solutions alongside traditional services, and a whole range of other interests interested in essential bodies to combine those resources and information to know more and do more. So we're seeing our data and digital experts at the Ministry of Health beginning to really work alongside our mental health experts in that parts of our ministry to really drive and get those cogs moving. One of the things that a brilliant colleague of mine, Cambrian Berry, who is an innovator at an amazing organisation, a charity here in New Zealand called Ember Innovations, has begun working on from a multitude of these conversations, is developing what he is terming an innovation ecosystem model. So this is a model that firstly looks at how we centralise what we do from an equity focus around people and whānau in the communities, and that everything that is done is driven by a very clear look at what their needs and their current experiences are through projects, community co-design, projects and data, so that we ensure whatever we're doing is driving towards those essential outcomes, that model and that ecosystem is built on trust, transparency and respect and integrity amongst all of those cross-sector collective collaborators. So you can see here everything from the non-government services and government supports and formal supports within the community to those capital investors, central local government, the corporates, NGOs, university and research, really attempting to look at how we ensure that collaboration of innovation enablers and innovative supporters is there to work with the community to develop, firstly, that clarity of need. We need to look at those infinite number of solutions and problems and work out what we are going to tackle and what is the most sensible way to do that. and to really drive innovation in a really cohesive and collective manner. So there are models, there are talks going on, there is work to look at how we do this most successfully. And I think really it is about coming together and what we need to do in terms of that cooperation that we know that is going to support our innovation and involvement into the future.
Anna, fantastic. Thank you very much. Really, really good. Okay, let's move on to our next speaker. Can I introduce you to Andy Greenshaw? Andy is the professor at University of Alberta and is the professor of psychiatry and neuroscience and a fellow of the Royal Society of Arts, trained in Europe and Canada, a fellow of the Canadian College of Neuropsychopharmacology, I had to be careful with that, for which he served as president from 2000 to 2002, and the Collegium Internationale Neuropsychopharmacologicum, and he served as University of Alberta Associate Vice President for Research and served as a member of the Scientific Advisory Board of the Institute of Neuroscience, Mental Health and Addiction. Andy has broad research interests that range from neuroscience to policy and mental health, with particular interests in AI and machine learning and e-mental health. Andy is a founding member of the University of Alberta Computational Psychiatry Group, working closely with members of the Alberta Machine Intelligence Institute. And since 2016, Andy has served as Digital Scientific Director for the APEC Digital Hub for Mental Health. Andy, we're looking forward to hearing your presentation and thoughts on global efforts to address stigma and discrimination.
Thank you very much, Gregor. It's a great pleasure to be here, and the 2022 Congress was very eye-opening. One of the things that I'm continually having reinforced is that there are silos all over the place, and every time we get together, we discover more about what other people are doing that is very complementary and very useful for the efforts we're making. So in this global forum represented by this webinar today, it's really important to think about the commonalities. So we had a work group on stigma and discrimination, and the core members I'm going to list with my cheat sheet here: Fredrik Lindekrona, EMIC board member from Sweden; Michelle Blanchard from the Mental Health Commission Australia; Martin Orr, New Zealand psychiatrist; Julie Smith, psychologist in the UK; Victoria Hornby from Mental Health Innovations UK; Dow Bishop from Ember Korowai, Takitini UK; myself, and Kartiga Kanesha from EMIC New Zealand. We had a really interesting discussion, and one of the key things that came up for me that is extended by every conversation I've had since is that since COVID pushed us over the digital divide, we've started to ask some key questions that are particularly pertinent to digital health. The fact is, when you step back from digital health, these are the questions we should have been asking a long time ago. And one of the messages that came out of the work group was that discrimination and stigma really come out of a lack of understanding. There's some work in Canada that's been pioneered by Senator Stan Kuchar and Yifeng Wei, who've put out online programs about mental health literacy. And the Mental Health Commission of Canada and other national commissions have worked on this. The more we understand about something, the less we are likely to discriminate. And if you see the interest of people who are philanthropists, typically they've had some mental health problem or crisis in their family that's raised their awareness and led them to go out and try to raise funds or invest for the public good for dealing with mental health. So very much information is important. Understanding the problems of mental illness and understanding what mental health are really key. Some of the things that were highlighted are that digital services, Shout in the UK and Need to Talk in New Zealand were examples of being used more and more, and that these digital services should not be ring-fenced. We should be broadening them out rather than restricting access. Discussions about what stigma is, there's self-stigma, stigma from populations, institutionalization as stigma. Governments don't change things, they react and respond. And so the idea is we need to really have a public discussion so that people indicate what is necessary and what's important for us to make progress. When we look at many of the digital offerings, if they're to be equitable and appropriate, it's really key that people with lived experience and living experience are the people that are involved in co-creation. That's one of the things that's come out absolutely consistently. And when we look at the offerings in the digital arena, many of them fail because somebody decides this is a good idea based on a lack of knowledge. And having people who are living in that domain, dealing with things, actually come together and co-create things means that the product will be useful and they'll get buy-in. The important thing about that is it also takes down the barriers between people who are seen as people with mental health issues and people who are looking after people with mental health issues. We know that mental health is everybody's business. It's pretty universal. So co-creation as a key piece. We need to separate mental illness and mental health. Mental health needs to become recognized as a positive thing, mental well-being, as opposed to simply treating mental disorders. We can give people other options. Peer-to-peer contact came up loudly. We are going to present a paper on this that will be widely available. We had about 20 points that came out. Co-design is a very big one. It leads to appropriateness culturally in terms of ethnicity, religion, spiritual beliefs, age-appropriate things, everything that comes under the umbrella of equity, diversity, and inclusion. So the EDI lens is really important to put in place here. With a move towards what I think is a democratization of digital health services going out, I think there's a lot of hope around overcoming discrimination and prejudice, increasing mental health literacy to get rid of or diffuse stigma and have everybody pulling together. Mental health as a universal problem is critically important. There are issues about looking at human rights and trying to understand how in digital offerings these things are taken into account. Now we're starting to look at the bias of the creator in digital apps and digital surveillance of individuals. And we've come to learn through AI tech that it's not simply the logic model that's being put in place, but rather the people who are building this, their views and attitudes in a very subtle way get built into what we consider AI structures. And so there's going to be a lot of movement forward. I think that's about it for me. I'll pass it back to Gregor, and I look forward to Q&A.
Andy, thank you very much. That was excellent. I love the, I really think people will probably want to explore some of the issues around AI and your phraseology there, the bias of the creator. Just to remind people, if you've got any questions or comments you want to put in the chat, please feel free. It'd be great to have some questions. We've got a very, very international audience. We've got people from Sao Paulo in Brazil. Hi, Luis. We've got Lynn in Vancouver. We've got Ananya in New York, Linda, New Zealand, people from the UK, colleagues in Hong Kong. So we are truly international this evening, which is absolutely fantastic. Okay, let's move on to our next speaker. We're going to go to Fiona Costello. Fiona Costello currently serves as the Senior Vice President of National Accreditation for Orca Health, where Fiona supports the design, development, and delivery of digital health assessment projects globally, including the US, Europe, and APAC countries. Fiona has over 15 years of experience in healthcare with the NHS, private sector, and non-profit, including an organization called Silver Cloud, where she supported the expansion of the technology within the National Health Service, mental health services in the UK. Fiona is the daughter and granddaughter of nurses, and she's found that healthcare is in her blood, and she's very passionate about improving healthcare services to the benefit of future generations. Fiona, we're looking forward to hearing from you.
Thanks, Gregor. Good morning, good evening, and good afternoon, depending on where you are in the world. It's really exciting to hear that there's multiple countries appearing today. It's a real honour to have been invited to talk about the key takeaways from the conference in Auckland last October. And I just wanted to share some reflections in terms of the power of collaboration in digital mental health when it comes to assessment. Excuse me while I just work out the screen. So I think what really came across loud and clear is that we are united by the same problem. There are literally hundreds of health apps and devices for patients and clinicians to choose from. And our goal is to provide confidence that the health and wellness tools reviewed in the Digital Health Assessment Framework, which is a US framework, meet quality, privacy, and clinical assurance criteria in the US. I've chosen a quote from one of our colleagues, the ACA, the American Telemedicine Association CEO, but I think that the issues that Anne raises in that statement extend far and wide. And we see these conversations taking place in Australia, New Zealand, Canada, the US, in Europe. And what it shows is that we really are united by the same problem, and that in many ways we're united by responding to that challenge with solutions. And again, what came across was that there is that agreement in principle about what is necessary to support digital health activation and the standards that guide digital health deployment, but we're still really quite siloed in approach. You can see the US Digital Health Assessment, there's an EU ISO that's forthcoming, the NHS Digital Technology Assessment Criteria, the Canadian Mental Health App Assessment Framework, which if some of you were in Auckland, you would have seen our colleagues at the Mental Health Commission of Canada presenting on, and they've done some really world-leading work actually, which I'll come on to specifically with regards to mental health. But you've also got the German DIGA, the Netherlands, and work that we've been doing in partnership with organisations in New Zealand. So you can see that there is general consensus that this is really important. And much like we do for medication, it's really important to support the development of that digital health infrastructure that guides the safe and effective deployment of digital health technologies, because we recognise its importance in addressing these really systemic challenges facing healthcare today. That includes demand management, capacity planning, resource optimization, meeting people where they are, especially in mental health. It's really important that we are guided by those who've lived and living experience to understand what works for them, and what works for someone might not work for the next person. And I think that's why in the conversations that were taking place in Auckland, there was a real clarity in the value that there would be in convergence in digital mental health assessment. And the reason why I think it's valuable in digital mental health assessment especially is because as a sector, we really are well primed to really lead the way and lead the charge in achieving that convergence earlier rather than later. We've worked towards convergence and assessment of globally accepted standards. They include data and privacy, technical security, stability, usability and accessibility, professional assurance. So far, not controversial. In fact, I don't think any of the areas that we look at in digital mental health assessment or digital health assessment are controversial, but it's the way in which we implement and deploy those elements. But by building this kind of and working towards a comprehensive global baseline for digital mental health apps, we can then enable individual countries to focus on those specific needs and requirements that can often be at the heart of decision making for our healthcare professionals, patients, and citizens. We know that to be true in New Zealand. The sheer focus, which again came across loud and clear in Auckland, was how do we make sure that the technologies are fit for purpose for our Maori and Pacifica. In Canada, it's for the Indigenous people of the First Nations, the same in Australia with the Aboriginal Torres Strait Islander. So it's right that we support those individual countries to cater for those needs and requirements by providing those bespoke assessment standards. But it's not right that we're asking countries to repeatedly put in place schemes that are asking for the same thing, which is why convergence in digital mental health assessment is so important and so needed, but also so so widely accepted by the industry. And that includes digital health suppliers who will absolutely benefit from this approach. It will incrementally drive improvements within the digital health supplier market. They'll have initial assessment, there'll be transparency and accountability and frameworks around how to guide what a good app looks like and what they should be thinking about. There's the continuous market monitoring that reflects product updates and upgrades. Then there's activation. And I think activation is a really exciting space moving forward, because we can really start to become much more nuanced in how we assess products if we get these foundations right. And that includes looking at patient-reported outcome measures, patient experience measures, improved clinical outcomes, and thinking about how that kind of plays back to demographics to enable targeted recommendations of products that will then meet those very individual needs that really fundamentally determine who we are as individuals, but how we receive and respond to healthcare. And I just wanted to end on the point that the reason why this is important is because it does support the clinical adoption and patient outcomes. I think we're way past accepting whether digital health is a good thing or not, or whether it's here. I think that COVID has certainly accelerated it. But I do think that now is the time for national bodies, but more importantly, global bodies, to support national bodies in enacting digital health assessment at scale, at pace, but in a really sensible way that allows that very targeted approach for Indigenous populations, for cultural safety, diversity, equity, and inclusion, tequity if you're in the States. And I think that setting these foundations is a really good way that we can work towards achieving that. So it's a real pleasure to be here. And like Andy and like Anna and I'm very excited to hear about the conversation, including getting onto that subject of AI.
Fiona, great. Thank you very much. That was fantastic. And just a great call for collaboration as we all try and do some of the similar things. So that's great. Let me introduce our final panelist, Dr. Charles Smith. Charlie is the first regional director for the US Department of Health and Human Services, Substance Abuse and Mental Health Services Administration in Region 8. I had to count my Roman numerals there, where he leads Federal Authority for Mental Health and Substance Use. He provides consultation, leadership, and partnership to stakeholders on behavioral health policy, financing, and program implementation to fortify and innovate behavioral health prevention, treatment, recovery, and the workforce infrastructure. Prior to this role, Dr. Smith served as the director of the Colorado Division of Behavioral Health and was Deputy Commissioner of Mental Health and Substance Abuse. A licensed psychologist, Charlie has over 25 years of clinical experience in fields of forensic psychology, addiction psychology, emergency crisis intervention, integrated care, and behavioral health policy and administration. Charlie, it's great to see you again and fantastic to have you here. So without any further ado, over to you.
Gregor, thank you. It's great to be with everybody today and actually offer some takeaways from my participation in the EMHIC Congress meeting in November, but most importantly, to provide some kind of insight into kind of what's happening in the US. And the timing of this conversation is really quite perfect. May, the month of May, is known as Mental Health Month, and it was established back in 1949, really is a way of increasing awareness to the importance of mental health and wellness. And for the last 22 years, SAMHSA, as the federal agency for mental health and substance use, has been leading the mental health awareness campaign to really bring to light the important vital role that mental health plays in our overall health and well-being. It's an opportunity for us as a country to really elevate what the behavioral health ecosystem is and how it has foundational elements around prevention and early intervention, crisis services, clinical care, clinical treatment, as well as rehabilitation and recovery. It's also an opportunity to really highlight those kind of fortifying forces that support that ecosystem, which includes the workforce and financing and research and evidence-based practice and also policy. And then finally, we also want to pay great attention to the importance of health outcomes, the patient experience of care, and how we can do a much better job of elevating equity, diversity, and inclusion. And in thinking about today's conversation, this May is Mental Health Awareness Month. Is also this tremendous opportunity for us to think innovatively, kind of outside the box, and see a world where that behavioral health ecosystem is advanced and enhanced, not at all replaced, by a technological medium. Really thinking about how electronic, digital mental health and digital prescriptive therapies can play a very significant role in this ecosystem to really help support individuals, families, and communities. And kind of that introductory framework is really kind of influenced and definitely my thinking for the last 6 to 8 months after attending the EMHIC conference, which was one of those kind of wow, aha, just overall life-changing conferences that I think we all hope to aspire and having. And for me, it was one of those, to actually be involved in a global conversation, to kind of engage with global partners who are really forefront, all of you are forefront in the fields of how to apply, how to build, how to think differently about how to reach individuals, help shape their lives through a digital medium and platform. I think at the same time, it's actually caused me to reflect quite a bit on, there's a lot happening in the US, not only in the private sector and the commercial sector, but also within government as it relates to digital therapies and digital mental health. Within the US government, you probably know that the Food and Drug Administration that provides a lot of medical product oversight and prescription regulatory products has now created a center for digital devices to include digital mental health. Our National Institute of Health, and specifically the National Institute of Drug Abuse, for the last 20 years has been standing up a center of excellence for addiction and technology at Dartmouth, and really leading at the forefront a lot of research, but again, very specific around addiction and substance use disorder prevention, treatment, and recovery. Our Administration for Health Research and Quality has been doing a lot of compilation of healthcare practice and its application of digital therapies in those centers, and being able to kind of get that information out to the community. And then clearly our Centers for Medicaid and Medicare Services are thinking differentially about how to finance through a public health insurance model. And then within SAMHSA, as much as we don't have yet a very clear platform, we have lots of monies and grant dollars going out to states, tribes, territories, and local communities around substance use and mental health prevention, treatment, and recovery that is supporting technology, supporting the application of digital therapies in their individual state or local ecosystems. Yet what's really fascinating to me is that there's not been this organized effort within the US federal government. And I think this is where what's really exciting is that SAMHSA is now positioning itself to actually pull together these major agencies like the FDA, the National Institute of Health, the Centers for Medicaid and Medicare, the Veterans Administration, to think uniformly around, rather than operating independently, how can we actually build definitions, regulatory governance functions, as well as to ultimately support innovation at the local level. Sounds easy, and in some cases, I find myself in this old philosophical debate, which was this tug of war between altruism and selfishness. And I think to some degree, at least in the US right now, there's this idea of collaboration around digital mental health is experiencing a bit of this tug of war. How to do the common good at the same time, how to actually support capitalistic innovation and development, and how can we bring those two worlds together? The idea of a tug of war is not to actually have a winner or loser, but to find that happy medium. And I think one of the ways to do that for the success for collaboration is really to identify those champions, the right people with the right unifying purpose that we could actually get behind when it comes to digital mental health and those digital therapies within that behavioral health ecosystem. And I think that there's an opportunity for us to leverage this idea that it takes leadership and partnership, evidence-based practice, and really good data, plus resources that are super flexible, and to wrap that around how to move forward digital mental health, digital prescriptive therapies within the US will be helpful with those right champions, which I'm excited to see SAMHSA stepping up and playing that role and to be a part of that. And clearly with EMHIC and this global community very much as anchors for our efforts. So with that, Gregor, I'm going to pass it back to you, and I think we have some time for larger discussion.
Charlie, thank you. That's great. I'm going to invite all the other panelists in. I love the metaphor of the tug of war. Where I come from in Scotland, unfortunately, it is about pulling the other team over, but I like your move to keep everyone in some kind of perpetual state of balance, which sounds great. I'm going to work with that metaphor. Thank you. It's great. Okay, so we now have everyone back in. I just have to do a little bit of what's called spotlighting of everyone. Oh, I think it's already been done. Okay, that's fine. Okay, let us move into, great, I've got everyone spotlighted. Okay, if you've got some questions and comments, please do put them in the chat. We've got a couple of questions. I've also got a few things I'd like to ask, but let me just go with the first one. So Samson, thank you very much for your question. Samson from Hong Kong. Let me just get up to it. Okay. So I'm going to read it out. It's wonderful. Oh, no, hold on. Sorry. Where will the generative AI take us to regarding digital mental health? Can each panelist give me a couple of key pointers, please, and opportunities and/or challenges, such as service users, care and support, and workforce training? And then we had an addition to that from Richmond, and Richmond was saying, where will generative AI take society with regard to digital mental health? So people, very much on your minds is AI. So Anna, let's go to you first.
Look, I'm no expert in AI, so I'm actually going to come at this from a completely different angle. I think the technology is there. I think what needs to happen in terms of where it takes us is that organisation and collaboration on an agreement of where it should take us. I think, technology is going to take us in any direction we want in the future. And we have to be very, very careful around where we decide it takes us and who's making those decisions, what influences us. We know where we have taken healthcare previously has been often very ethnocentric, very much focused on certain conscious or subconscious agendas and bias, whether that comes from different professional groups that lead in clinical roles, whether it comes from different political parties that are there. I think that, to me, the key important point is that it's about getting very clear and savvy from a very humanistic point of view, and from that very essential nature of where our species needs to go so that we can solve all the other challenges like climate change that we've got, and from a better perspective of mental well-being and psychological flexibility. So to me, I will leave the AI discussion to our experts behind me, but that is where the focus needs to be first so that we can really then harness any other decisions and shifts that come with innovation.
Andy, let's go to you then. You talked about bias of the creator, and I've been following quite a lot of what's been happening in some of other parts of the world, particularly around Africa, where there is a really big movement that is trying to counter the Western-centric North American, European-centric use and delivery of AI. Have you got any thoughts?
Yeah, I'm going to say something that you might surprise most of you. And I'm going to say that, you know, the whole thing about generative AI, it's very powerful. You can go and train things on everything. There's a lot of commonality between people. If we were to transcend the boundaries of stigma and discrimination, we would find ourselves coming together in new ways of understanding. So this is a really important point from a digital perspective, because you don't have to train everything and build everything for a different human being. We have a lot of commonality. If you move to the indigenous space, whether it's Africa, Asia, South America, the indigenous view is us. Typically picking on Europeans, the European view is us and them. So within the European view, you have lots of discrimination. You don't have to go away from that base. In terms of digital, what we need to do is we need to build tech that is suitable for everybody. And I like one of Anil Thaplial's terms he introduced me to, which is global. There are global and local issues across the family of humanity and our relationship with the environment and all of that stuff. There is a huge commonality. We need to learn how to navigate that. And actually, through the work we're doing with digital, we're learning that a lot of non-standard cultural views, particularly if you go to people of the Pacifica, the Maori, indigenous people of Canada and Africa, there's a different way of thinking that is actually helpful and appropriate. So one technical point I'll make about generative AI is people worried about it. They all want to do it because it's so great. And then they discover this bad stuff. So they back off and they start complaining and worrying about it. It's tech. Generative AI is a wonderful approach, but it's not a thinking thing. These are logic and language models. And it's up to the creators to put guardrails around them. You know, you don't let children play with heavy equipment. In the same way, generative AI can be used very helpfully, and it can be very appropriate. But generative AI can be trained to be culturally appropriate, given the right material. So one of the big problems we have is we always talk about how do you regulate the internet? This is one of those issues. We have to learn to make choices. Pandora's box has been opened. Hard to regulate things. People have to choose, and people have to be enabled to choose. And I'll leave it there. Thank you.
And I really like that level of humanity and actually optimism. So I'm really encouraged by that answer. Thank you. Fiona, can I come to you about, you know, you're our panel expert on standards and regulation. If you were in the position of a government looking to regulate AI or regulate, what would be the two main things that you would do, and what would you be wanting to achieve, particularly if you think about some of the hyperbole around AI?
I think if anything, it proves my point, which is that we need to double down on the foundations to be able to focus our attentions on this. I don't think, when I speak with my Orca hat on, I think that when it's come up in conversations that we're really keen to swap notes, and we're really keen to collaborate and learn from each other about kind of the issues. Andy always speaks so pertinently about the issues relating to this kind of thing, but I am inclined to agree that you know, that we are in a position to guide its deployment. There's some of the things that I wrote down which are sort of inherent in our digital health assessment frameworks already, which I think are crucially important in terms of how we kind of guide the regulation and assessment of AI tools, is verification of sources. So it's a bit like thinking about the difference between evidence-based and evidence-informed. So your evidence-based, thinking about research that guides the use of the tool versus, you know, open source internet that then guides the tool. But it's those sorts of things that I do think we need to be kind of cautious about. But I think that applies to tools in general. And definitely inherent biases in data for all the reasons that that can have created arguably stigma and discrimination in the first place. Those biases and not building them into our assessment frameworks and paying due regard. But I think there's an opportunity to produce guidance, and especially through the likes of EMIC, to kind of create position statements and thought leadership around kind of the really pertinent things that make technology meaningful to the individual that's using it, so that they can instill that trust and confidence. I'm personally a big fan of it, but I do think it needs those guardrails.
Good, great. Charlie, can I come to you? Because when you were speaking, I was thinking about government and innovation and creativity. And, you know, those words can all go together in one sentence, but one of the things that I have observed with some of the digital providers that I have had some associations with and others that I've heard of is that they worry about governments cohering and collaborating because they feel that government may inadvertently, in a desire to stimulate, control, get the best from the market, it may stifle innovation and creativity. Are you facing any of those thoughts and challenges in the US? And if you are, what are some of the things you're doing to counteract some of that preconceived ideas that government and innovation can't go hand in hand together?
Yeah, I think that's a very good frame, Gregor, and those are challenges that we've seen even in other lines of business, not just this area of technology and its application in a mental health, behavioral health space. But let me kind of first say, much like Anna, I'm not a technical expert in this space, and I definitely kind of definitely tracking where Andy and Fiona are sitting. And I think that part of where government plays a role is using the guardrail analogy that Fiona indicated. Is what are the guardrails? How flexible are they? How tall are they? Where do they exist? And who's helping create them? And I think that that last piece is tremendously important. Whereas if government is seen and or wants to play an independent operator, as opposed to a partner with industry, with innovation, with research, we're not going to achieve that design that is going to be much more shared, and it's going to be feeding off of, I think, some of the distrust and or add to that distrust, Gregor, that you're identifying. But we've seen this throughout, and I do think, at least in the U.S., there has been a tenor of partnership that is very different, and the tenor of partnership is not only across government, but also with industry. And I think this is a space where SAMHSA does not have a lot of history, in part because the mental health community has not had a lot of history in this space. But I think that we're able to open that door. The other piece I really want to kind of leverage is that when we think about the creator, we need to be thoughtful of to what degree are patients' voices in that creation, and informing what we think about AI and informing about the type of technology that is moving towards guidance, and to make sure that our patients, our communities, our families are part of that process, as opposed to just independent individuals that may be reflecting industry and or government.
Great, fantastic, thank you. Anna, can I come to you now? I'm going to change the subject a little bit. It's about collaboration, because you have embarked on a very, very ambitious set of collaborations right at the heart of government, national, regional, and local levels in New Zealand. Can you, from your experience, just share with us some of what you see as the basic behaviors that you think lead to good collaboration in this space, and really riffing on what Charlie was saying around where the voices, where the lived experiences, because if we are collaborating but not focusing on communities and individuals, families and carers' needs, then what are we collaborating for? So if you could share some of your insights into the collaborative behaviors that you want to see more of.
Yeah, look, I think this comes down to, and I mean, I've worked in the sort of psychological and therapy fields for a long, long time. So to me, this is about the basic abilities for people to collaborate and be willing, that openness and genuineness. And the challenge that we have is we have a variety of people around the world in different, very influential, powerful seats that perhaps say and may think they want to collaborate, but in fact, you know, for whatever reason, may struggle to do that openly and may well wish to potentially even continue being in those powerful decision-making positions. So what we're attempting to do really is sort of start to run at some of that quite openly in some of our communications and talk about that transparency and push and continue to keep talking until we find the right people to speak to and get that real, I suppose, infection of what needs to happen in that collaboration, so there becomes quite an obvious and almost undeniable agreement that we need enough people around the table. We've begun talking in New Zealand about the distrust that's been there long term, these big elephants in the room that haven't perhaps been talked about that stop collaboration. And so we're really working to build that trust. And I think particularly for some of the innovators that may well at one time or another seek funding and are seen as being an industry, it's those funders needing to hear that we're focused not on competition and revenue, we're focused on outcomes, that everyone has that central, very altruistic need to move our societies forward and to create happier, more just, thriving communities that have opportunities available for all. So it really is, I think, again, centering around that agreement of how we do that. And it must come back, which we've all talked about that focus on moving the power actually into the communities. We need to be ensuring that these communities, these people, these families that we're there to serve, that we are listening and we are centering directly through that research and development and exploration and co-design phase of anything that we do, first and foremost, with therefore center that they lead.
Anna, thank you. That's great. I'm struck by the passion that you're describing the collaborations with, and these things take time. They really do. We are in the last 3 minutes of this great Fireside chat and webinar, so a little bit of a time check to myself and others. Thank you, Margaret, and also Tim, for your thoughts in the chat. I've got a couple of thoughts. So really, back to each of you for a very short kind of 1 or 2 point answer. And if you were to say what the most important focus in your jurisdiction or country is at this time to shift the dial in the direction that we want it to go, that's collaborative, that's there for families, people with lived experience in communities, what would be the one area of important focus that your country, you would want to see happening in your country? Fiona, let's come to you, and by country, I guess I'm going to throw you in the UK country, although I know you work globally.
Yeah, I think for me, it's a human business. I think that we have to bring healthcare professionals on this journey with us. And that includes some of the old school approaches to clinician engagement, as much as it does, we couple it with digital health technologies, but without them, we can't do it. And I think it's really important that we maintain their involvement, because it's about the patient and the clinician at the end of the day.
Fantastic, thank you. Charlie, over to the States.
So I think, Gregor, the 2 words that come to mind are unification or unity and partnership. And I think for the US right now, it's actually bringing people together, have a unified vision and partnering together to move that vision forward to support individuals, families, and communities.
Fantastic. Anna, and then Andy, you last.
Very quickly, formalizing that innovation ecosystem, that actual living, breathing, collaborative network. And there is a model there. If anyone wishes to look at it and talk further, you can connect with me or Camry and Barry. We need to actually identify the divisions and really work out and practically organize those groups and get those conversations going, so that work starts to happen.
Fantastic. Andy.
Very briefly on a complex point, we have an opportunity to do things differently with health. Mental health is what we're looking at now. Physical health and mental health are related. If we can find ways to enable people to help themselves and be informed, we will take the monkey off the back of the health system. We will be able to reach more people, and the developed nations of the world will be able to reach out and offer that support in conversation to co-create solutions for low and middle income countries, and everybody will benefit. And we have to pull together and be positive about that model. In that model, commerce is not a dirty word. Somebody has to own something, somebody has to make a living out of something, and we have to find a more amenable EDI approach to that whole ecosystem lens.
Andy, thank you. That's fantastic. And can I just thank every single one of our panelists for contributing so much to a great discussion and some really, really great thought-provoking issues. Okay, well, we've come to the end of today's session. A big thank you to all of you out there for joining us for this Fireside Chat today. Once again, if you're interested in watching previous webinars or accessing the EMIC Knowledge Bank and enjoying all the other benefits that come with being an EMIC member, head over to EMIC Global, emhicglobal.com to set up your membership and get started. Thank you very much, everyone. And I think from what I've heard, it underlines the absolute importance of thinking globally, acting locally, and I know it's global. Thanks, everybody, and wherever you are, have a very good rest of your day, evening, or night.